Hey, everybody. Hello and welcome to Live More Life, the good news about your health podcast, where we're going to dive deep into the world of healthcare, longevity, mental health, and wellness to bring you the most up-to-date insights and the recent breakthroughs in improving your personal health. My name is Dr. Eric Reese. I'm your host and healthcare co-pilot on this journey to a healthier, happier you. I'm also very fortunate to be one of the co-founders and the director of health and wellness at Nobody Studios, a high-velocity venture studio focused on building 100 companies in the next 5 years. And don't ask us what our 10-year, 20 years goals are. Every week, we will be exploring topics on the Live More Life podcast, where they're going to range from talk about diet and exercise, from nutrition and mindset, everything. We're also talking about recent medical breakthroughs and new technologies on the market. And today, Minderful is one of them. We're also going to be combining integration of Western and holistic medicine practices into one exciting perspective. We're going to have a range of different perspectives, different opinions that are coming onto this podcast to help you, the consumer and the person, understand what's actually going on in this space. And this is all designed to empower you with the knowledge and motivation to live your life to the best. And I am super grateful for my dear friend, Dr. Nick Pryor, to be on today's podcast. Dr. Pryor is a renowned expert in mental health. He's a psychiatrist. He's an entrepreneur. The dude's rap sheet goes on and on and on. This guy has so many cool things to share today. And what's great about what Nick is bringing to the table is that he not only has the clinical experience, but he also has the real world experience of being a provider and a practitioner, and also to bring a company to market. And so while this is far easier said than done, I'm super grateful to have Dr. Nick Pryor on the show today. Nick, great to have you, and thank you for joining us.
It's great to be here, Eric. I'm looking forward to this.
Yeah, day one. I initially I know that there's so much more to your background than what I just provided. So, Nick, can you just do us a favor and maybe just give everybody a little bit more background information about kind of where you started, where you came from? And I think people are also going to know how you did a 7,000-mile bike ride to India as well. I think we're going to have to put a caveat on that as well, too, for us.
Yeah. So, I mean, we can all tell our own narratives quite smoothly, but mine is a bit of a checkered one, and that's got a lot to do with the kind of primary motivation for the work that I do today, and that's my own lived experience with bipolar. And that answers your question as well, Eric, as to how I ended up doing a 7,000-mile bike ride, and that's pedal biking from England to India. It was whilst I was on a hypermanic episode, kind of feeling very energized, very confident, and very impulsive. And it took, I think it was one long bath. I made the connection of some time I'd spent in India and wanting to give back to that part of India. And I thought, well, I want to raise some money for this place. And I didn't want to do a marathon or some of the standard things lots of other people were doing. And I immediately kind of came out of the bath thinking, I'm going to bike there on my own. And a month later, I set off. So that's how that happened.
It's brilliant. Yeah. So how long did it take you to actually do that?
Close to 6 months in total.
That's wild. I've always wondered how people execute on that, and I'm sure that's a conversation for another day. But that's really cool, and what a great way to just share your story and your mission, right? I mean, it was all part of it, and something that you were able to discover about yourself. So, Nick, maybe take the viewers through a little bit more about your clinical background, and maybe bring us up to speed today about what you're currently up to.
Yeah, so I initially did a physics degree at Imperial College London and was much more kind of maths heavy kind of growing up. But it was after my own experiences that I actually quit my job and went back to medical school to do a medical degree, but knowing from the outset that I wanted to specialize in mental health and become a psychiatrist. So I've gone through medical school now, and I've now been working in the NHS for close to 7 years. And I think it's worth saying within the NHS, so I don't know if we've got some American viewers here, but the National Health Service is our huge kind of behemoth of a provider of health. It's free at the point of delivery. But as part of my training within that, it's the big plus point is I get a huge opportunity to see a very diverse range of patients. So I'll be working in places like Broadmoor, where we have some of our most kind of dangerous and complex patients, right through to kind of community health practice in Notting Hill, in some rich areas of London. So you get to
Sure.
see the whole melting pot.
Yeah. I'm curious to hear from you just what your experience has been working in the NHS. And as an American who was fortunately, I lived in London for 2 years, but I didn't get a ton of time interacting with it. I've met a lot of doctors who have worked in it. It'd be interesting to hear your perspective about the NHS and kind of what you've experienced. And I know that there are good things and there are always bad things. It's, it's inevitable with healthcare systems. Can you take people through a bit? I know that there are some Americans that are probably listening to this as well too, or will be at later stages. And so take us through a little bit of that. That'd be a really interesting topic to start with.
Yeah, I mean, I'll try my best, but I mean, the NHS is, like I said, it's a big organisation. It's the fifth biggest employer in the world. It services the whole country, free at the point of delivery. But what that means is that the delivery is set by the funding from the government and the expectations of the whole population, not an individual segment of the population. So it means that often there are areas or parts of the system that aren't working as well as one would hope for. And I
Sure.
think that's really driven by more macro factors, things that will be happening in America as well. So you've got a more aging population, you've got a more unhealthy population, you've got more and more expensive medical interventions being invented and being put into these services, all of which are creating an environment where demand is outstripping supply.
Yeah. Yeah. Do you see, I mean, with your role and where you're sitting, I'm going to kind of make the assumption that you probably saw an opportunity within the NHS. Otherwise, you wouldn't be building Minderful and going after this. And so maybe take us through a little bit of that journey and what brought you to where you're at today with building out an application or a platform that's there to actually serve people that where you see maybe others aren't being able to execute on that.
Yeah, I mean, I think that the general rule that I apply is that the NHS is, because of it being such a big organisation, it's like a tanker. It's very hard to move.
Sure. Yeah.
And even the Labour government coming in now with a massive majority will find it hard to make meaningful changes to the NHS, let alone an individual clinician. So I think the real answer for people like myself who are frustrated with the service provision is to think about kind of breaking it or kind of innovating outside of the NHS. And I think you've got to be quite radical. You've got to want to put out some quite difficult, contentious ideas, and it's very hard to follow through on those within the NHS. I think you've got to do it from outside.
Yeah. And how's that journey been for you so far? Like, take us through a little bit of the journey of where you started as a clinician, being in practice. I mean, you didn't mention you have an MBA, and I think so many people in the startup space are like, gosh, I have to have all this experience in business before I go and do this. And what I love about what you've done is you're like, no, I'm just going to go do this. So I
Yeah,
applaud you for that, but I would love to hear more about that journey.
yeah. I mean, I think I'm lucky because I had sector-specific experience that gave me confidence to kind
Yeah.
of go out there and do it. I think the process of becoming an entrepreneur is best learned on the hoof, kind of going
Agreed.
out there, learning through trial and error. Some people have obviously been very successful doing it through the kind of MBA route or whatever, or other kind of more corporate structures. I mean, at times at Mindful, it's been very difficult, and we've recently gone through a difficult patch where we've had to pivot and contract and refocus. And I think the overarching thing, when if I'm feeling really low or difficult about it all, I just think, if I hadn't gone through this experience, I would probably still be kind of closed eyes in my little silo in the
Yeah.
NHS, plodding away. And so even if I think that process of learning and learning to get the combination of business acumen with clinical expertise is sadly a rarity. And I think there's real value that can be created when you merge those two together.
I couldn't agree more. Um, I think you are really getting a real world MBA. And that doesn't take away from anybody who's gotten an MBA through school and education, because those are very relevant and very powerful. But there is something to be said about just cutting your teeth on the real world experiences and starting a company and going after it. And so I applaud you for that. I know how hard that is. Believe me, the battle scars are very real. And I know that there are people who are watching this as well too, can relate to that. So our mutual friend Johnny Pollock said he's looking forward to this. So Johnny, thanks for joining us. Richard Buchanan also said hello from London as well. So good to have them all on here. Nick, I'm curious to hear from your perspective. Why do you think so many people struggle with mental health today. Now, there's an argument to say, well, we're so much more aware of it, we're more open to it, we're having the conversation. But we take a look at a lot of the rates, even like Caucasian males, especially in the States, like 18 to 24, like suicide is a massive, massive factor now that is affecting so many individuals that we really maybe either weren't talking about before, or maybe it wasn't occurring as often. Why do you think we're struggling so much with mental health today?
Yes, I think a lot of it, in some ways, a lot of the issues were hidden, if you went back a generation or so. But I think there is definitely a case to be made that the incidence and prevalence of mental illness is increasing because of the way in which we live our lives in the modern
Yeah.
world. But it's very difficult to find definitive. It's hard to get direct causality. So a lot of it's just showing your kind of intuition and there are some statistics to back it up. But I think the biggest factor that always comes out when you look at it, and certainly on a qualitative point of view, is the way that we're connecting today in today's world. And by that I mean the way in which we're using phones and social media, and basically this hyper connection where we're having all of these engagements, these dopamine rushes, but we're not actually having any real, authentic moments of real humanity.
Yeah. Do you think we'll ever be able to get around that? Where we're so stuck in a digital age, and we're shooting this podcast and you're in London and I'm in Minnesota, right? And so there's purposes for it, but how can we as a community, as a society, really start to change that trajectory?
Well, I think it's not easy. And I'll just give you an example. So, I mean, I can't remember who said this. I think it was one of the founders of PayPal, not Elon Musk, but someone who said, people are horny, lazy, and greedy. So, if you're trying to solve those problems, it's quite an easy fix.
Yeah.
It's much harder to try and create positive behavioral change in the way that we're talking, where we're saying, go out and go for a run, change what you're eating, and don't give in to your immediate desires. And I think the best way of demonstrating that is with one of my favorite behavioral change models came out of UCL called the Combi model, which basically says, and is quite obvious, but it's still useful. So it says you have to be capable of doing something. You have to have the opportunity to do it. So can you afford to go to the gym? But then most importantly, in today's world, you have to have the motivation to do it more than anything else in your environment at that point in time. And that's the problem. There's so much noise. There's so much distraction. We're finding it very hard to do the simple kind of good habits that actually make us feel happy and connected and valued.
Interesting. There's some interesting discussions going on now as well too, with a couple different platforms that are utilizing research about like just in time activity, or like kind of essentially saying, Nick, when at this point in time when I see your heart rate increase, I know you're doing something, and based off of HRV, I can say whether it's beneficial or negative, and I can cue you in that moment to try and change your brain or your characteristics, right? But I'm aware of that Combi model, and that's interesting. There's probably a lot of great neuroscience behind that. So why don't you help the viewers on here understand a little bit more about the work you're doing with Minderful? Kind of what is it? What are you approaching, and how are you implementing this tech-based platform to be able to help people optimize their mental health?
Yeah, so Mindful, we just say, I suppose let's start with the foundational model of modern psychiatry and psychology, which is the biopsychosocial model. So there are biological factors, so things like your genetics, and we tend to, I'm simplifying here, but we tend to target those with medication. There are psychological factors. So were you bullied at school? Did you have a traumatic event when you were younger? Were you abused? How did your parents parent you when you were younger? And we tend to look at or try and manage those with therapies, so cognitive behavioral therapy, psychoanalytical therapy, psychodynamic therapy, whatever it might be. And then you've got the social side, so biopsychosocial. And the social side is what's in your immediate social environment right now, and what are you doing right now? So are you going to the gym? Are you having meaningful conversations with your loved ones? Are you having a good diet? And generally speaking, it's been easier to package up and monetize the biological and the psychological interventions. So there's the whole model for pharmaceuticals to kind of go on their R&D pipeline. That being said, though, the funding in mental health is a quarter of that relative to disease burden as in physical health. But that's another story.
Yeah.
But on the psychological side, it's, as well, we've managed to package up certain forms of therapy that are very mainstream. But to try and like put value to a social intervention, like saying to a 30-year-old man who's feeling depressed, I think you should go to the gym. There's no commissioning model. There's no way in which we can fund that through the NHS yet.
Sure.
And what we wanted to do at Mindful was try and create an accessible direct-to-consumer proposition where people could be engaged or immersed in audio content that inspired them to start taking up and collecting kind of wellness activities, social interventions, a bit like what we would call, and I think, and, you know, I think the Scouts are big in America as well, but, you know, Scouts for the mind. We'd create this environment where people could start to collect and collate their very own kind of playlists for their mind, their kind of unique formula.
Interesting. And how are things going so far with that? Are you guys seeing the changes you expected? Like, what are your learnings? What are lessons? I mean, as an entrepreneur, there's always going to be things you're like, I thought this and we found out this, but then also I didn't think this and we found this. And so keen to get more feedback from you about what that experience been for you.
Yeah, I mean, I think the biggest learning for us was we tried to go, we invested too much in tech too early.
Sure.
We hadn't validated the user experience enough in analog form. So, you know, what we're doing now much more is strategic partnerships where we can deliver the app, but we can also deliver more analog kind of workshops, training, coaching around it, so that you actually provide the touch points and the motivation partly outside of the app. And we're trying to create an environment where they can kind of grow together.
Yeah.
And that's really come about mostly in kind of the B2B space, going into corporates and SMEs and targeting kind of really high impact areas of those businesses in terms of particular parts of their workforce that are struggling for whatever reasons around motivation, their resilience, their mental health. And we'll go in and we'll provide that more intensive analog support, but with the principles of the app and the app supporting it.
It's interesting. Where do you think most people go wrong when they're trying to change a habit or they're trying to build a new habit?
I think we don't make it simple enough, and I'm a very much guilty of that. I've written up many routines. I've used our app quite a lot. I've collected lots of different badges, lots of different activities. But really, at the moment, for me, I've broken it down just to three main things for me, which is regular exercise, which is at least exercising more than 30 minutes 3 times a week. No alcohol for me is a big one, and watching my weight as well. And that's more than complex enough. And I think it's really just breaking it down to the 2 or 3 things that really make a difference. And then you can start building on it. We have created, you might have come across Maslow's hierarchy of needs. We had kind of adapted that to Maslow's or Mindful's hierarchy of wellness.
Love
And
that.
a big part of that is just being aware of where you are in your life at the moment. So before we joined, I was saying I've got 2 young kids at the moment, and I was kind of much higher up the pyramid a year or 2 ago, but now I'm just focusing right on the baseline. What are my absolute needs? And that's enough. And setting expectations is a big part of it as well. And feeling good about doing just enough or doing the core bits.
I appreciate that. Nick and I were literally just having a conversation before we got on this live about saying no to things and really having to kind of narrow our focus and bring things in. And I'm so guilty of being like, yep, I want to do that. And then when the moment comes, it's like, gosh, like I forgot I completely overcommitted. And so there's something to be said about that because, you know, a kind of a stressed brain is a messed brain kind of mentality, right? And so when you're all over the place or you feel disconnected, it's easy to feel like the wheels are falling off the wagon and everything's going down. But Nick, I think something that you said really resonates with me, and I'm sure resonates with others, is that if you build these baseline habits, you can stack other habits on top of that. And, you know, everything that you mentioned from exercise to limiting alcohol to watching your weight, all of those things are properties that will help you optimize your brain's ability to promote neuroplasticity, which is the brain's ability to change and form new habits. So, Nick, you being in the tech space, you being a clinician, and I know you're still working with patients, but you're also building, you know, your company as well too. Where do you think the future of digital health is going to move?
So, I mean, for me at the moment, the kind of the big message that I push is that, you know, there haven't been any massive innovations in the actual interventions we use for a good 20, 30 years in the mental health space. There's some new stuff coming through in terms of psychedelics and stuff like that. But I think what's so obvious to me in my practice is that actually, we've got some really good tools in our arsenal, in our rucksack to kind of to apply to patients, but we're not being honest with ourselves about the likelihood of them actually using them in the right way. Or and when I'm working in the NHS, compliance and kind of actually getting alignment with one's patients is a big thing, and I think there's a lot of opportunity around. We have a, so I'll give you an example. We have a so I'm working on at the moment on a psychiatric intensive care unit. These are people who are very unwell, generally psychotic, to the point where they become aggressive, at risk to themselves or others. But actually, if you really go in quite heavy, get your kind of antipsychotics into them, within 2 or 3 weeks, you'll see a massive change. Probably within a month or 6 weeks, they'll be discharged. And we will have spent a lot of resource, a lot of time getting to them to that point where they're stable enough and well enough to go back into the community, but we won't actually provide them with any tools or whatever to actually embed any changes or to actually learn from the experience. And generally speaking, they will, or not generally, but many of them, 6 months later, the same signs of early psychosis will come along. They'll do the same bad behaviors or difficult behaviors, and they will end up back as an inpatient. And I think what interests me most at the moment is capturing or optimizing what we've already got so that it actually kind of gets laid down meaningfully into people's daily lives. And I think that that's obviously a very general point, but at the moment, for example, there's no app that the NHS allows our users to access, 24/7 after they've left the hospital, and I can't understand why that isn't the case.
Yeah, that's interesting. There's always this saying about an ounce of prevention is worth a pound of cure, right? And to your point of you mentioning the fact that these people are coming in a very dire, unfortunate psychotic event, you need to be able to triage that. But then more importantly as well, how can we prevent that from occurring in the future? I think, especially in the States, when we look at our medical system, we're so reactive and we're so responsive. And there's a big push right now from a lot of different types of doctors and a lot of different people in healthcare talking about we need to prevent this. We don't need to, just say, oh, we need to understand the genetic makeup for why somebody is dealing with an issue. That's important, but how can we actually support them through their environment, through diet, nutrition, exercise, sleep, those social interactions, like you mentioned? And so I think you were spot on with that. There's no one answer for this. It really will take a, multifaceted approach. And so from your experience and where you sit with things, like where do you think we should be moving in the mental health and digital space versus where we're going?
Yeah, so I mean, I think at the moment my emphasis, or I think the biggest kind of opportunity to kind of get good mental health care to everyone is through the more kind of innovative kind of social innovations or kind of ways that are more scalable. This current model of care is too expensive.
Hmm.
There isn't space for me to see already there isn't space for me as a psychiatrist to see any of my patients in a meaningful amount. So I'm there just to manage risk and to prescribe drugs and to
Fair.
kind of be a decent kind of overall decision maker. I think we really need to look at what is that relationship between healthcare professionals and tech, and what does that user experience look like? So maybe it might be that I think we're in the UK at the moment there's a massive debate going on around what we call physician associates. So they're people who can do quite a lot of the roles of a doctor, but not all of them. But they only have a 2-year training process,
Fair.
and I do think the workforce or how we use people needs, however much we might like the idea that we could deliver it such that every patient could see a psychiatrist and
Yeah.
whatever, that's just not, it's not possible, and we need to be quite honest about that. And I think I like the way that the idea that tech can kind of just hold that thread between all individual important, and it shouldn't just be relationships between the patient and healthcare professionals. It should also be holding the threads of relationships between loved ones. And one of the big innovate or things we put forward in Mindful was this idea that actually it's the key, a bit like kind of next of kin, but we called them your rock. But the person who fundamentally, if someone gets really unwell, if they're very unlucky, they won't have anyone to turn to. But normally there'll be one very clear person who's identified as the person who steps in and
Yeah.
supports them during that period. And we don't really even ever talk to them very much at the moment in the NHS. And I think engaging whole system around the patient is another thing that needs to change.
I love that. There's been some interesting discussions about supporting individuals who've been diagnosed with cancer and how it's all about that individual, that person, but how do you actually support the family members who are there to support that individual who's been diagnosed? And it's kind of the same conversation in mental health, right? As you're given this diagnosis, and whatever your diagnosis is, to be fair, it could be mental health, or it could be a dire diagnosis like pancreatic cancer. And you're kind of thrown on this fast moving train that's moving 100 miles an hour, and then you're just told to get on it. And it's like there's no guidance, there's no feedback, there's no recalibration, and you're unfortunately, no one's prepared and no one's been trained how to be a patient, right? We've been trained to be
Right.
doctors, but patients have never been trained in patients. And so there is a massive gap there. And I'm very excited for what you're doing at Minderful. I know that you've done great work. I just know you as a person, and I know you're helping so many people for the right reasons. um, I by no means am an expert in AI, but I use it every single day. And I'm sure you've had the discussion as well about what is AI going to do or not going to do. What are your fears? What's exciting to you about what you think AI could do for people in the mental health space, and how this can actually help people live a healthier life, or potentially, pour gasoline on the fire of where we're at today?
Yeah, so just before this, actually, I was speaking to a guy called Tim Fakra, who's co-founded a company called Amy, who are basically trying to create that kind of mental health companion who can kind of be the 24/7 kind of support, but obviously knows when also
Hmm.
the red flag rings and they need to get analog input. But I think speaking to him, I mean, it sounds, as we know, the power of, it's going to be exponential, the growth in the power of AI. I mean, I've heard the ex Google X guy talking about it, Mo. I've read quite a lot about Elon Musk. I mean, I am a pragmatist and I'm an optimist, and I believe that we will find a way to use it to our advantage. I mean, there are already huge, lots of the big American NHS, not NHS, sorry, hospitals are already recording everything live and then processing it and interpreting it and summarizing it and making actions based on just a sign off by the doctors. And I think that will become the new norm very soon in a few elite kind of really innovative hospital chains. But I think what's scary is that it's probably going to take another 20, 30 years until the NHS gets to that. So I think for me in the UK, it's a lot about how do we kind of find ways to attach it to what's quite a complicated, broken system already, but can we kind of just bolt ourselves in somewhere and get a bit of
Yeah.
efficiency? But there aren't going to be these moments, I don't think, of sweeping change, because most healthcare systems are very kind of quite entrenched and quite hard to change, mainly
Yeah.
because of the fundamentals of, healthcare is very, very important. We don't want to take risks, which we don't need to. And also, the whole defensive medicine that's come about with the increase in the kind of the legal, the legal side of medicine, as well as
Fair.
making it very hard.
Yeah, fair. No, that's a valid point. Jason had a great comment that I wanted to highlight. He said he loved the potential of new, more accessible to train roles. He said it seems like we invest a lot in training people to a great level of expertise, and for the most time, you're not able to use most of that expertise in day to day. So I'm sure that can resonate with you, just especially in psychiatric care in the NHS. That not only are there needs for humans and for roles, but these empathetic, highly trained doctors who are intuitive, but to be able to use those skill sets. And so any comment on that comment that he made?
Yeah, I think that's a brilliant comment, and I think, yeah, we're very in the NHS, well, where I work, for example, we spend so much time still doing administrative tasks.
Yeah,
The amount of actual patient contact is very limited. So I think that's what's exciting, I suppose, to maybe from a final point on my side, is that there are so many low-hanging fruits for us to kind of to get onto, and I think it just takes, what I've realised is it just takes, there's still the importance of building credibility and relationships to really follow through on these things. It takes longer than I probably had thought 5 years ago.
fair. Yeah. So you're saying you actually want to help patients and not spend time doing paperwork? Like, what a crazy concept, Nick.
Well, I think on the flip side to that, though, I think I and this some people would totally disagree with this, but I think there's a big issue with a lot of doctors not wanting to get involved in. There's almost this kind of holier than thou kind of view that we've been trained to be this elite kind of. We specialize in looking after this particular part of the mind or body, and we don't deign to do management or leadership. But I think the more we can get clinicians like on the leadership and management side, the better.
I would agree with you. A couple of things on that. Nick, thank you for joining us today. You highlighted something on this last comment that I think is really relevant. There's a group in the UK called Bite Labs. Are you familiar with them?
Yeah, I am actually. Yeah, but not very familiar. But I know
Yeah.
the name. Yeah.
So Bite Labs is essentially a group started by Azim Alam and the Bite World, Zach Hanna as well. And what they were doing is they're taking providers from clinical practice and they're helping them through an 8-week fellowship to essentially do what you're doing with Minderful. Kind of become entrepreneurs, find a problem they want to solve. They want to learn about marketing and branding and building an MVP, understanding markets, and then they're trying to solve problems in the healthcare space. And so Bite Labs is a great group in the UK, and they're actually trying to launch in the US as well to take providers, much like yourself, who see a problem and say, listen, I want to solve this problem and I want to build a company or a platform to do so, to try and help and scale this thing we call healthcare. And so I'll get you connected with Azim. I think that would just be a great conversation for you to have, whatever purpose that serves for you or mentorship and leadership for them. But I do think we need more people with clinical experience like yourself, building companies, challenging the status quo, and going out to solve these problems. And so I applaud you for that because I know it's not easy. I know it's stressful. I know it has a toll on your mental health, right? The irony of what we're doing. So thank you for kind of your service to mankind. I want to give you the chance to end this. Where can people find you? How can they reach out to you? And what would you like to leave our listeners today with from the discussion we've had today?
Yeah, I mean, I think where we're, we started to talk about leadership and management there. I think, where we've done a lot of work recently in Mindful is trying to optimize kind of people in the workplace. The boundaries between work and life have got so much more complicated. People are, increasingly, as we talked about earlier, struggling with their mental health. And, if you want to talk more about kind of bringing performance into the workplace using kind of the principles of the biopsychosocial model and mental health, yeah, do reach out to me probably on my LinkedIn or just www.minderful, that's ER in the middle.com.
Awesome. Yeah, appreciate that. No, Nick, it was an absolute pleasure for having you. And I'm sure we'll be, having discussions about doing this again some other time. So, ladies and gentlemen, thank you all for joining us today. That's it for today with Dr. Nick Pryor. I hope you found this as enlightening as I did. The best part about doing these podcasts is that I genuinely just get to ask questions that I want to ask, and I get to learn a ton from amazing experts like Nick. So, Nick, thank you again for joining and sharing your expertise. To our listeners, remember to tune in for the next episode of the Live More Life podcast. We'll be posting this on all podcast platforms with post-production as well. And that's going to be it for today. So stay healthy, stay positive, and thank you again for joining us. Until the next one, we'll see you soon.